Unclenched podcast with myself and Dr. Alexandra George. Today, we are going to be answering some of your guys' questions. But before we do that, you know me, I have to catch up with my Alex. How are you doing?
I am good. I'm good. Just, living the dream, as everybody says. And been busy at the office, so it's all good. And I want to get back to a patient though that I saw recently. So this patient comes to me from Connecticut, and she's a great girl, but when patients from out of town come, they always know they have to come back. And sometimes we have this issue of with very few patients, but Karen's one of them, to try to stay on track with treatment. So Karen came to me because I was speaking at a meeting, and her sister was there, and she's a sales rep for one of the dental companies. And so she's like, you have to come and you have to see Dr. George. So she came, and she needed a fixed orthotic. But when we put the fixed orthotic on, she had an implant that went bad. And so she had like missing teeth here and there. So it was very hard to get stability on her or in her mouth. So finally we got it, and I had a partial made so we could decompress that joint in the back because there were some missing teeth in the back here. And she texted me this morning and she was like, I feel so good.
Good.
And I'm like, just stick with this, because in the meantime, too, she had seen a prosthodontist at home in Connecticut who's like, I can do that. You don't have to go all the way there, blah, blah, blah.
Oh,
And got into her head. And I'm like, look, it's either me or him. And if it's me, you got to listen to what
yeah,
I'm
yeah.
going to do. You got to be here so I can treat you. And I know I can do it. I can't comment on what he can do because I don't know him and I'm not in his office. So maybe he can do it too. And if it's more convenient, so you don't always have to fly over, totally up to you. But I was just so happy this morning when she's like, this is it. It's great. I feel good, slept well. And I'm like, thank you, Lord. So,
I'm so
yeah,
glad. Yeah. Well,
yeah,
well,
yeah. So, what about you? What's going on with
yeah,
you? How
just
are the kiddos?
busy.
How's the hubby?
No, they're good. Everyone's good. Everyone's just I had 2 patients just in the past 2 days that were like, "Oh my god, your daughter is your clone." I was like, "I know.
Yeah.
I've heard that before."
Isn't that
Yeah,
funny?
it's I know she is. She's totally my twin. So that's been fun, just having them around more, and I get to see them more throughout the day. But yeah, I mean, your patient brings to mind a patient of mine that, she's actually probably the one that's traveled the farthest to see me. She came from the UK. And
Uh-huh.
she got, her orthotics made, and then she knew she wasn't gonna be able to come back, and I told her, "I don't know if I can help if you can't come back." Like, I'd
Right.
never encourage people to come from far, especially if they can't commit to the course of treatment, right? And so she
Right.
was just like, "Well, I still want the orthotics because it's still better than anything I'm getting here." I said, "Okay, I'll make them for you," and I checked in on her today. I just was like, "How are you doing?" Because we kind of lost touch. This was a while ago that she came in.
Yeah.
And without the therapy that I do and me checking and adjusting the orthotics, like, I don't know if how much it's gonna help, right? I've never really
Right.
done that before. And so she said that she's doing a lot better. Like, her pain has gone down quite a bit, and she's really happy that she came. So I was like, "Good." 'Cause it's hard to
Yeah.
know if you can't gauge it and see them again and, do what you
Right.
need to do. So
Right.
that was really
Yeah,
relieving.
there is a commitment to
There
that,
is.
yeah.
Yeah.
Well, good. That's
I
great.
know, I know. So
That
that
is
was nice to
great.
hear. She's super sweet. But, so
Yeah.
yeah, why don't we delve into some of the frequently asked questions or just questions that
Sure.
we get, not even frequently asked, but why don't we start with,
Sure.
what do you recommend for pain relief for pregnant women? I've had TMJ for years, but it got worse after having my daughter a few years ago. I'm pregnant again and it's awful.
Oh,
Oh,
you poor
I
thing.
know.
Poor thing. So this reminds me of when we had your sister on. She's an endocrinologist, and remember she was saying how a lot of people during pregnancy it gets worse with the hormones and everything like that. I still treat pregnant
Me too.
women. I do you treat pregnant women?
Yes.
Yeah. So, it is awful, and just think about this for these poor women. They're pregnant. A lot of them don't feel good while they're pregnant, or when you're pregnant, you just feel so bloated and so it's I don't know, to me, pregnancy, I wasn't like, "Oh, I'm pregnant, I love it." I'm like, "Oh my god, get this kid out of me.
Mhm.
I feel fat."
Yeah,
Like, I just want to be done. That's the kind of pregnant woman I was. But, so you can still get help. Just because you're pregnant doesn't mean you can't be treated. And what do you recommend for your patients? I mean, it's tough to be pregnant and then be tied at home with a little kid because she has a daughter
I
too,
know.
and then you can't really take care of yourself. That's hard, but you have to kind of find somebody to help you.
I know. Well, if they can come to see me, we're very kid friendly at the office. And what's funny is my team will even help take care of kids if like the mom
Sure,
needs them.
same,
Because I do a lot of hands-on therapy. So the mom
same. Yeah.
patients, not just the moms, but patients love that because it helps to loosen up the muscles and that can last for days and days of relief, right? So if you
Hmm.
can get in for hands-on therapy, that's always good. Or finding like a TMJ massage therapist that's done it a lot, that can be helpful. But for at-home tricks, like I love those heated or those microwavable neck pillows.
Oh,
Oh,
love
I love
them.
those. Those just ease up the neck so much, and then you can even
Yep.
just wrap it and hold it around your jaw. And
Hmm.
then for those with, like, really bad headaches, they do make those migraine ice cap things that you put in the
Right.
freezer. I've heard that those are really helpful, so I think on my YouTube no, Amazon storefront, forgetting all the names of all these different platforms. Amazon storefront, I have a bunch of products that can be helpful for
Hmm.
home use. If you can't get in, if you can't get out of your house, you're too busy with your kiddos, there's stuff that you can do at home to help too. Even those face rollers
Yeah.
or the
I love the
I
face
love the
roller.
face rollers. They help so
Yeah.
much. And the TMJ massage pen, have you got one of those yet?
No, I haven't
They're
gotten one of those
good. The
yet.
my
Are
TMJ
they?
relief pen, yeah. So it vibrates and it has a little bit of heat to it. Or a lot of heat. You
Uh-huh.
can heat it up quite a bit actually. But you
Uh-huh.
can get into your masseters really well, and it's gentle enough because there's no percussion that you can use it on your temples too.
Oh,
I love that
nice.
thing.
Nice,
Yeah. So that's
nice.
what I
Well,
mean, do you
that's
recommend anything
yeah,
else?
that's the best we can
I know.
offer, just kind of Band-Aids a little bit until you can get some help.
Sure.
Another question we got here. Do you have to do orthodontic treatment after wearing an appliance over time? Well, you can continue to wear an appliance. You don't have to do orthodontics. You can always do restorations to fill the space of where the appliance was. It depends on what your overtime is, too. If it's been a long time, like we're talking years, a lot of times you've had a change in the joint and you won't close back to your natural teeth. So you have to have something in there. So your choices are really an appliance. You can do orthodontic treatment or you can do build-ups with crowns.
Mhm.
What do you say? Is that the same with you?
Well, yeah, I think if the bite changes significantly during treatment, right, you have to do something to get that
Mhm.
bite back. What I do to
Right,
kind of lower the risk of the bite changing drastically is I have my patients wear a daytime orthotic and a nighttime one, and then we wean them off the daytime one. And once the muscles calm down enough, you actually don't need the daytime one anymore. But you have to wear that nighttime one forever. If you lose that thing, all your symptoms are gonna come back, right? You're gonna deal with little flare-ups through your life because every time your teeth come together, and that's usually the main cause of TMJ problems is your bite or one of the main causes, right?
right.
So every time you chew without, a good bite, then there's a chance your symptoms could come back. So it's like the way I do it is sort of like managing it long term, right? But to get to the root cause, many times it's a good idea to fix the bite.
Right. But not everybody's an orthodontic candidate
Not everyone's an orthodontic
either.
candidate, and
So
not everybody has the money for the porcelain restorations,
true.
right? So
And
it's hard.
the other thing too I've had people that wore an appliance for a long time, took them totally out of the appliance, saw how their teeth came back together, and T-scanned them, no appliance.
Yeah.
How do you like that?
Yeah, I've done that too.
Yeah,
Exactly, exactly.
yeah.
So that's a hard question to answer because there's so many different.
It's hard because you can't see them. You can't see them. You can't see their joints, you can't see
Yeah,
what the teeth are like,
yeah,
you don't know what the previous bite was like, you know,
yeah, yeah.
or what have you.
Well, here's a good question. This is an interesting one. What is the
Mhm.
TMJ treatment you offer? So you go first, Alex, and then I'll answer.
Okay. So, TMJ treatments we offer in our office are DTR, disclusion time reduction. We offer orthotics. We offer orthodontics, and we offer restorations to change the way your joint comes together. We also do, like Priya, manual manipulation and laser therapy, and by manipulation I mean massage or trigger point injections, but that's all to get you to another kind of end point, not just to hold you stable or not just to make you feel good for a few days, but that's all in the process of doing any of those treatments.
Mhm.
How about you, Priya?
So yeah, we do orthotics, we do disclusion time reduction therapy. We don't do orthodontia, so we're different from you there. And then my new associate has a lot of experience with full mouth reconstruction. So
Yeah,
we're
you that's good.
Yeah, I mean, and some patients just will really benefit from it. Like, for example, I have a patient who's came to me with some I would say mild to moderate TMJ issues, and he didn't take treatment. He was just because they all went away. So he thought he
Mhm.
was feeling fine, and then he came back with his jaw locked closed, barely opened his mouth, and he was in a ton of pain. So, he has a very, very deep bite, and he's congenitally not congenitally, sorry. He lost tooth number 8 when he was really young, and so all these teeth have, like, drifted together.
Oh,
And the bite's super deep. And
yeah.
so,
Ooh.
we got him unlocked. We got him feeling really good. He was wearing the orthotics, like, 24/7. He weaned off the daytime one. He was just wearing the nighttime one. He was doing good. He was doing good. He was doing great, and then the pain started coming back. He didn't lock again. But I was like, "We have got to talk about your bite, because like, your
Yeah,
bite is, like, leading all of this, and it's been a problem for, like, so many years that, like, you're just gonna probably have to keep coming back, and, like, to not fix the root of the problem for you, you're gonna spend the same amount eventually in, like,
right.
constantly the orthotics and the therapy and the this and the that." And he had been talking to his general dentist about his bite for, like, many years. So I he didn't have, like, sticker shock with the porcelain restoration part of it, but he might be a combo case where we do some ortho to create space in the front. We're
Sure,
not gonna get a good
sure.
aesthetic outcome with the way his teeth have drifted together. So he's probably gonna do ortho first and then come back to us for the restorations, but poor guy.
Yeah.
Like,
I had a patient that kinda reminds me of that, and, she had tooth number 7 congenitally missing. So when they did her ortho, they pulled her all together. And when you pull everything together, you're making the arch width more narrow, and she had terrible pain and headaches, and we got her out of pain with an orthotic. Then I did ortho on her, and I opened back up that space, and we put an implant in there. And my gosh, it has to be 6 or 7 years, and she's been pain free and a
wow.
beautiful smile because now it's symmetrical.
Yeah. Well, you changed her life, with the
Yeah,
pain
yeah,
and the symmetry. That's
yeah,
awesome. That's awesome. Um,
yeah. She's a great girl. Here's
oh.
an here's another question. I have so much pain in my entire jaw face is changing, even getting an underbite.
Hmm.
So I'm thinking she's coming more out like Jay Leno, like
Yeah.
coming forward maybe.
Yeah.
And then my insurance is terrible and I'm broke. What do I do? Well, I think that's a tough situation
Yeah.
because the reality of life is money and everything costs money. So the only thing I would suggest is some of the things, Priya, that we mentioned for the pregnant lady,
Mm.
like just to kind of make you a little bit more comfortable. But your jaw is changing because your muscles are working improperly. So that's a hard one. You don't have money to help you is tough. I don't know.
I don't have an answer.
Get 3 jobs to help you? I mean, I don't know.
I don't
I
know
feel
either. I
bad, but
know it's hard because all of
and
these
insurance doesn't help with TMJ to begin with. So,
insurance
don't
doesn't
think you're
help.
missing out on
Yeah.
anything because if you had insurance, that doesn't mean it would help with anything.
Yeah. Yeah. That's a tough one. I don't know. I feel like looking into different options like care credit or something. A lot of TMJ dentists
Yeah,
take that. Um,
yep,
you know, I don't have a good solution for that, especially if your entire jaw or face is changing. I mean, that's like a significant level of TMD is what I'm guessing. So it's not going to be
sure.
like an easy, quick, or cheap fix. Um,
Right,
it's a shame that insurance doesn't cover it. They should. It can be a full
right,
body issue, right? So
right,
I wish I had a
right.
better answer. I just don't.
Yeah, I know. I getcha.
All right. So,
I getcha.
help. I don't have pain, but my right side locks from time to time, and one side opens before the other, I've noticed, and clicks too, but no pain. Is it fixable? I would say that's fixable, but getting into treatment soon is a good idea because if it locks from time to time, it's just going to progress. It's going to start locking more frequently, and typically the pain comes along with that. And then it locks more and more frequently, and more and more and more and more. And eventually it gets to a point where it locks and you can't unlock it on your own. That's typically the
Right,
progression that I see. So it is fixable and it's easier to fix now if you're not locked when you go and see your TMJ dentist, right? So it's
right,
locking, but it
right,
sounds like it unlocks. So
right.
I would say go do something now before it locks and the pain really sets in.
Right. So what I think too about this is noticing clicking and things and not pain. A lot of dentists will say, "Well, if it's not hurt, don't fix it." Or, "Yeah, I feel that, but you're not having any pain." Pain is not always the indicator to TMD. A lot of TMD patients do not have pain, but they have teeth that they're breaking or they have the clicking and the popping, and that's not good, and it is fixable, and it's you've got to get somebody that knows how to fix them, interview them, make sure they know how to fix them before you just throw good money out the door. Yeah. So this is one I get a lot too, or we'll get calls at the office, or how does someone go about finding a dentist that will do a dental orthotic for TMJ? So I always refer to the ICMO website and say, see if there's someone near to you. But you always, I think we agree on this too. You have to call the office. Do they mainly see TMJ patients, or is TMJ just something they'll make a guard for? A lot of times that's not going to help. So you've got to kind of interview that office. What questions would you ask the front desk whenever you're calling, or if you would have someone look?
Yeah, well, I have a video about that actually. It's called Questions to Ask Your TMJ Dentist. Like
Hmm.
some of them are like, what is your success rate? How frequently do you treat TMJ? Have you treated
Right.
disc displacement without reduction? And if so, how do you treat that? I mean, that can tell you a lot about the office right away.
Right.
Um,
Because you throw things like that, they'll be like, "Well, I don't know what you're
mhm,
talking about,"
and then
or,
you know,
you
yeah.
yeah,
Or like,
yeah,
what percentage of your practice is TMJ only? Or like, asking the
right.
right questions. I don't even send people to any website because I've done that in the past and I've gotten yelled at. Like, I saw this doctor off the website you sent me to, and he was awful. He was such a quack. You need to be more careful with your referrals. So now I'm just like scared. Like, I send people to you.
Yeah, and I can understand being scared because it's
Yeah.
it's a reflection on
Well,
you,
yeah. And
but
people are
I
already mean
think
enough when
you
you're
can
online. Like, I don't need to be
right,
yelled at more.
right, I get that a bit, but okay, whatever.
Yeah.
Um, but I think though, if it is something that's reputable like ICMO, website, you still have to ask the questions because they
Yeah,
can belong to an organization. That doesn't mean that they're active in that organization.
sure.
That doesn't mean that they've done a lot of the schooling or have their fellowships or anything like that. And
It
that's a
doesn't mean
big thing,
anything,
I
yeah.
think, when it comes to that.
Well,
So they could have attended one class and be on that website is my point. So you still have to call the office, like Priya said, and ask the good questions.
so yeah, for anyone that's listening or watching this podcast, we are gonna be attaching the video of questions to ask your TMJ dentist to the YouTube version of this. So go ahead and, if you look through the description box, we'll attach it everywhere we can, so that way you guys can reference that.
Okay. Perfect. Perfect. So another question, can TMJ cause tooth pain? My Lord,
Heck
yes,
yeah.
yes,
Yeah, there's
and yes.
yeah. Yes, yes, and
I
yes.
had a patient Yeah, I had a patient in the office yesterday, okay? She's 26 and no cavities at all in her mouth, okay? None. She just had 2 root canals on 2 bicuspids. So she has now 2 crowns
Oh,
and 2 root canals. Like, it's your bite. No cavities, but
no.
the teeth were sensitive, so the dentist did 2 root canals. Like, I wanted to jump out the window. I mean, I see it all the time. People will get unnecessary root canals because a patient's in the chair and there's like, this is so painful. And sometimes dentists will say, like, I'm not seeing anything. And sometimes patients will say, I don't care, do something. So they do a root canal on it. But you get referred pain. And what we'll do too is I will link a pain chart that will show you what muscles will give you referred pain to what
Oh, good
teeth.
idea.
You know, you'll get pain from the masseters in your if your masseters acting up, you'll get pain in teeth. If your traps or SEM are acting up, you will get pain in teeth. So I will attach that too, so you can just look at the referred pain chart. And once you get the pain and get the connection, you'll get it under control. I'm sure you see that a lot too,
Yeah.
Priya. Like, this tooth is always
And
hurting
the
or
the
whatever.
temporalis muscle can refer pain to the front teeth, like, it's crazy,
Correct.
the pain referral patterns, and many times these angry muscles refer pain into our teeth, and you're like, "My teeth are just aching," but it's not coming from the teeth, it's coming from these angry
Mhm.
muscles from TMD. So, yes,
Right.
TMJ can
Right.
definitely, cause tooth
Right.
pain. So, let's go over to, the next question. Do you do virtual consultations? Alex, you can go first.
Yep, yep, we do. We do virtual consultations. We do a couple things. We can do a virtual consultation, which will be a consultation with me, and we typically take about a half hour to do them. So we can talk. I can look at your teeth. I can't make a
Sure.
definitive diagnosis because I don't have X-rays. I can't see your joint. I can't feel your joint. I don't have readings on your muscles and what have you. But we can at least talk and chat and see if what your concerns are, I am very capable of treating, and I will let you know. The other kind of consult we have is a phone consult with one of the ladies in the office. They'll call you back. They'll answer your questions. It's not time with me, but it is a scheduled phone call with them. And that seems to work out really nicely too. What about you? I know you do. You do virtual
Yeah, we do
consults.
virtual consults. They're about half an hour as well, and I can give, like, a differential loose diagnosis, but I can't confirm
Yeah,
anything, through
right.
online, but yeah, we offer virtual consultations, and many people fly out to see us, after those
Mhm.
consultations, right? So,
Right,
I think it's nice that we can provide that service, and then, it gives
right,
people hope, like, "Hey, someone can help me." Um,
right, and I think the virtual consults are such a great thing that we do because you get a feel for, like, even our personalities, like, is she really getting what I'm talking
yeah,
about
yeah.
before you even get in the office? Because sometimes you'll see a provider and be like, they didn't even listen to me, or they don't know what I'm talking about, or they never saw this before. So you can get all those questions out of the way by doing a virtual consult. before you actually make the trip out to see either of us.
Yes, yes,
Yeah.
yes.
I think those are great. I love doing them. I get all excited. And then when I see someone in my office, I'm like, "Oh, I already feel like I
I
know you
know.
because we
Yeah,
did,"
I
you
always get
know?
excited. I'm like, "It's good to meet you in person."
Right, right.
Um,
I get excited too. I do. Let's see. How about oh, this one is another one. I have TMJ. I'm currently pregnant. I'm miserable. So that's just like the patient. She's hearing some crispy sounds. That's like the patient in the front. Yes, we can treat you even though you're pregnant, but then there are all those things from Priya's Amazon store and that can help you at least get through some of the discomfort that you're having during your pregnancy.
yeah, yeah, agree. Um, Hi doc, what's the best appliance for severe facial asymmetry? I don't know if there is an appliance for severe facial asymmetry. Like that can be because of so many different things, right? So I
Right?
don't know if there is an appliance for that. I wouldn't spend your time trying to look for an appliance for that. If you are having pain or dysfunction in your jaw joints and in the muscles of your head, neck, and jaw, getting that treated first by a really good TMJ dentist and seeing what that does to the facial asymmetry, and then addressing the facial asymmetry is what I would recommend. But I wouldn't expect TMJ treatment to completely fix severe facial asymmetry.
I agree with that because a lot of times with severe facial asymmetry, you might have the bone on one side of your face that's actually longer
Hmm.
than the bone on the other side of your
Yeah,
face. So it, it's hard to just say with that kind of question, severe facial asymmetry. I have had people with some pretty funky asymmetry, and you know, you get an orthotic in there, you relax the muscles, things look better, but they still might not be 100%. But then that's where I can go into orthodontic treatment with certain expansions or certain,
yeah,
you know, maxilla treatments for the maxilla. And if your jaw is canted like this, then we can get braces on and get rid of the cant. But I never, because I don't know how the outcome's going to
I
be. I don't
know.
have a crystal ball. Everything will be better, but to perfection, no. Like severe facial asymmetry, there's a lot you got to put in the mix to
There
look
is a
at.
lot, and I've had some patients come in here that are really chasing their asymmetry, and there was one where she was really symmetrical, and I was just like,
Mhm.
"I can't help you." I just said, "I'm not the one." Like, I I know my
Yeah,
limits.
and it's not like we can help
Yeah, we
everybody. We
can't.
can help the majority, but there are gonna be cases that we can't help or we can't take
Yeah,
on in our office because of different issues, you know, and there's a ton of them that can happen, but that doesn't happen frequently, but it does
it
happen.
does happen. Sure, sure. Um,
Sure.
can you help even though my discs are displaced? Yes, of course we can.
Oh my god. Hello.
Of course
You're
we
talking
can.
to 2 women that know what the heck to do for those displaced
Yeah, we
discs.
can help. We can help. So I will say though, with one little caveat in that is that the singular click or pop can be almost impossible to completely get rid of, right? The single click or pop, but we can prevent it from progressing to jaw locking, and I can usually soften it and decrease it. And then when you're
Yeah,
actually locked, I'm pretty good at getting you unlocked. But that's my 2 cents.
yeah. So with that too, and it depends on where on your opening the clicker
Sure,
pop is.
sure.
So if the clicker pop is like when you're just starting to open, we can get rid of that. Your mid open, we can get rid of that. Your maximum open, like a wide yawn click, never guarantee that.
Mhm. Mhm.
But
Me
the
too.
other ones are pretty much slam dunk for sure.
Yeah. Yeah.
Yeah,
What type of
yeah.
orthotic do you use when your patient is locked closed, like disc displacement without reduction? Do you use the pivot?
Okay. I use the pivot a lot, but a lot of times, like I just had a gentleman in that was locked closed. He couldn't open more than I think it was 22 millimeters. So, and I always go in there because I don't know, is it muscle
I
splinting or
know.
a true lock? And I always try to open them.
Me too.
I'm
I
like,
kinda
yeah, son of a gun.
yeah.
He's locked. So we lasered him a lot. We lasered him, muscle work. We got him to open to
That's
39.
good. Do you do the
So
muscle
I'm
work
like,
or do you refer?
I do a little bit and then a PT.
Okay.
Josh, we had on a podcast. I sent to Josh too, Dr. Herbert. So we did that. And then now he has just a terrible bite and I know it's going to come back. So what we're doing now on him, we just started DTR to make sure
Oh,
we
so
catch
he's
it now.
unlocked.
He's
Yeah.
unlocked now because the last time I measured him, he was 40,
Oh,
45.
yeah, he's
I said,
unlocked.
"Oh, right, we are
Sure.
unlocked." A normal opening is between 45 and
Yeah, yeah, he's
55.
unlocked.
So let's start on the DTR. And I was going to put a pivot on him, but, you know, I just thought, let's just see what's going on. And then we ended up not, and he didn't need it. He just needed the laser. He needed the work. I typically don't tens a locked patient because you don't want to tens. I don't want to tens on that disc
Right.
if they're locked. I just want to do the work and loosen them up. And yeah, so he had his first DTR appointment last week.
Okay.
So I'll be seeing him next week and I'll see how he's doing.
Cool.
Yeah. Yeah, so that is cool. So, another question. The first time you get the orthotic, is it made higher up on the edge of your teeth so that your teeth don't touch?
Is it made higher?
Not quite sure what they're saying, but I have seen orthotics where only the front teeth touch and the back don't. Have you seen when people do that? Like little ramps in the front?
Yeah. Yeah, like a
Yeah.
NTI style? Yeah,
Kinda,
yeah,
yeah, but
yeah.
they're still coverage in the back, but they're a little bit higher. Those typically, tend to cause more problems for most people, at least the people I see. I don't see everybody, so I'm sure
Oh,
it
yeah,
works for
I think
some.
those cause more problems too.
But yeah, and then what happens? Your tongue goes in that spot
Yeah,
because it's trying to balance out.
yeah,
So when your tongue's over in that back
yeah.
spot, then you start to get funky tongue habit, then that's a whole other ball
Funky
of
tongue
wax.
habit.
Yeah. Yeah,
Love that.
yeah. I'm not gonna go there. But so
Said it. I just repeated it.
yeah. So, yeah, that's not how we do that's not how I do an
That's not how I
orthotic,
do it
and I
either,
can't
yeah.
yeah,
Um,
so I can only speak on how I do it, and I know how Priya does it. I can't talk on that that's just different for me.
so I'm skipping over to what happens during a DTR appointment that helps reduce the pain. So, with DTR, it's amazing because we're balancing the bite.
Mhm.
We're removing the back teeth that are getting in the way when you're chewing, that are gnashing against each other and making the central nervous system mad and making the muscles mad. So, we're balancing the bite. We're removing those back teeth interferences. And at the same time, all of that is calming the muscles down. So, that's what happens during
Calm, calm,
calm,
calm.
calm, calm. Yeah.
And it's so neat to see the muscles actually because when I did that first DTR patient with that was locked, I did his first appointment this past week. We showed him his muscles. I'm like, look at your masseters. They were not working at all. They were like deadlined. And then once we adjusted him and he's like, yeah, my bite's starting to feel good. You can see the masseters start to recruit when I asked him to
Mhm.
clench. Before they were like, wah-wah.
Yeah.
I'm not doing anything,
Yeah.
not joining the party. And he's like, wow, I can really see that. And he felt it
Oh,
too.
yeah. Oh, I was just saying many people, like, right afterwards will say, "Oh my gosh, something feels different, like, my jaw feels lighter," or my
Mhm.
I had one patient who came in with a 4-day migraine, and during DTR, it went away.
I believe it.
Yeah, I was like, "Really? Are you sure?" Like, I didn't believe it.
Yeah, I know, because it's so like, "What?"
Yeah.
I know. Stuff always surprises me, and I always say that to my patient. I'm like, "Man, I can't believe this stuff that I get to
I
do.
know, it's really
Like, I'm
cool.
privileged to
I
do
know,
this,
we're
and I
lucky.
get to I mean, I think it's like I love it.
I
I
love it.
love it. But one of the questions was, is it true that the masseter is mostly fast twitch fibers? That is true, actually. And the masseter, believe it or not, is when you take the weight of the masseter and the mass of the masseter, I guess you would say, and the weight compared to other muscles, it's the strongest muscle in your body.
Mhm.
It can get to, I think it's like 200 grams pressure.
Mhm.
I mean, that's a lot. In fact, I knew a guy that had his finger bit off, the tip of his finger bit off by another guy.
Who?
And that is,
What?
yeah,
Who are these
yeah,
guys you know?
yeah. No, he's one of my very good friends. But
Oh, no.
he was going like this, and this other guy bit
Why?
off the tip of his finger. Well, obviously they weren't talking very nice to each other, but we're not going to go into that. But yeah, so pounds of pressure on that masseter is so strong, so
I'm a terrible
strong,
person.
and
I
it
just
is
can't
fast
believe it.
twitch because it's a
It's
it's
a
a
quick
quick
yeah,
movement. It's a quick twitch.
yeah.
Yeah, with the chewing and the grinding and the clenching, it is a fast twitch fiber. Or fibers, yeah. And a lot of this fast twitch, I think that's comes probably from somebody who's a weightlifter, I would imagine, or a
Isn't
bodybuilder
that
or
interesting?
something and
Yeah,
trying to
yeah, yeah,
build the
probably.
muscle. That's what I think that probably came from. But yeah, so that's that.
Well, very good. Well, I think this is our question segment, and I
Okay.
think we're done.
Yeah, so keep them coming.
Yeah,
We'll do another one. I love doing these because I love seeing, Priya, how you treat and I treat very similarly, but I always get a little caveat maybe from you or you from
yeah,
me. And I love to hear about the patients because I can relate. And it's just like I said, it's just I we're so privileged that we get to help people get out of
yeah.
pain, and, I don't know, I can't you can't go back to regular
No,
dentistry once you
not
do
after
this,
this.
and this kinda yeah, it's like you got bit with something that you're like, "Yeah,
It's like you
okay."
got your finger bit off. I'm sorry, I'm a
Yeah.
terrible person. I'm sorry, you shouldn't have told
It's
me
not
that
quite
story.
it's not I could tell you more later, but it's not quite like that. But
Oh my
anyway,
gosh.
so thank you so much for listening to our
Yeah, thank you
podcast or
guys.
watching our podcast, and we appreciate it. Keep the
Yes,
questions
keep them
coming,
coming.
and chat
Yes,
soon.
see you all later.